Dr. Amina Ahmed is a public health physician and she joins us here in Lagos. Thank you for joining us on the program.
Thank you very much. Thank you
All
for
right,
having me.
looking at flattening the curve, schools opening up, teachers preparing for the new normal, as they, of course, study and teach. We're hearing that from states like the US, there were a number of students, pupils that contracted COVID-19, and that the ages of 12 to 17 are as much likely to get it as also age 5 to 11. Now, in our efforts at the response at flattening the curve, do you think that there is still that fear? Or are we looking at the cases we're getting, which seems to be lower on the one hand, and this is also across countries in Africa that seem to be recording lower cases, and if we can say that we're actually close to flatten the curve? Because on the other hand, you have the government saying that we're not testing as much as we should be.
Thank you very much for that question. Actually, the COVID-19 cases that we're having, the most common age range that have COVID-19 from the research that has been carried out is between ages 31 to 40 years of age, so falls within the young people. But then when you have, like you said earlier, the cases where you have ages between 5 and 7, and then you have 11 and above having COVID-19, yes, it's very possible. They could have it, but the thing that has been noticed in them is that they don't really, they are mostly asymptomatic. But the fear that we're actually looking at is the fact that they could have it, they could be asymptomatic, but they would take it back home, where they have older ones at home. They have probably parents or grandparents who have underlying diseases that could actually contract this COVID-19 from the children. And that's where the fear is. So if they don't exercise the non-pharmaceutical interventions that are supposed to be done in schools and in the community at large, then we still have a fallback on people at home who unnecessarily didn't go out to get the COVID, but the COVID came back to meet them at home.
So in terms of protecting the children, the immune system has a lot to play in this. Tell us a bit more about COVID-19 and how it attacks the immune system.
Well, the issue with COVID-19 is it's a viral disease, so it affects the immune system as the other coronaviruses. This particular coronavirus is SARS-CoV-2 virus. So it actually depletes the immune system for a while, but it's not as bad as what you have with HIV. But then what you have with this particular one is that when it meets a depressed immunity state, it actually affects the person more. So the person is more symptomatic, and if there's an underlying disease, perhaps maybe diabetes, hypertension, and others, the person seems to be more symptomatic, perhaps even have more complications than when it affects another person that doesn't have underlying diseases. So you have, they're looking at a possibility just like measles and polio, where you have herd immunity with these particular viruses. But COVID-19 we haven't been able to reach that yet. The possibility of herd immunity would only come when at least about 70% of the population is affected with COVID, and then you now look at the possibility of having a herd immunity, and that we can't wait for that. If we want people to have that, you would have to wait for everyone to get infected, which would affect them eventually. The collateral damage is probably going to be more than the infection itself. So the only thing that will probably make us to get to that point is having a vaccine, which is still in the works. And perhaps the first time we're going to have one would be maybe in 2021, if we're able to get one.
Finally, in strengthening our immunity, especially, as the children, attend school, what should we be doing?
Of course, for children going to school, strengthen their immunity, it has to start from the home. All right, so they have to be from their feeding, from all the things that they carry out in the home, because a lot of things are wound around immunity. Okay, so the child has to be well fed, has to be properly, fed, properly protected enough to be able to go to school. The parents have their own parts to play, because when these children resume school, the teachers will do theirs, the guidelines are there, but the parents on their own have to prevent these children from having other diseases that would make them more depressed, that would expose them further to having COVID when they go out of home. So teaching them how to protect themselves, wash their hands properly, proper hand hygiene, respiratory etiquette, the social distancing, which is very difficult in children anyway because of physical meeting in school and all of that, and wearing of masks. That is also very difficult with children, but they have to learn it. So that has to be taught both at home and in school so that this can be prevented amongst children.
All right. We'd like to thank you. We appreciate your time on the program. Dr. Amina Ahmed, public health physician. Thank you for joining us.
Thank you very much. Thanks for having me.